it's Kristen here at UT Southwestern Medical Center. I'm excited to be chatting today with physician scientist Hao Zhu about liver cancer. Dr. Zhu is an associate professor with the Children's Medical Center Research Institute at UT Southwestern, and he's also an attending physician in the multidisciplinary liver clinic over at Parkland Hospital. We're excited to have him. Before we get started, I do want to thank obviously CRI, but also Parkland, the Moncrief Cancer Institute, and the Simmons Comprehensive Cancer Center for their support. Don't forget that we can't talk about specific, I have this condition, how can I be treated? But we can talk in generalities, and we're happy to do so. So to get started, thank you for joining us, Dr. Zhu.
It's great to be here.
It should be a really good discussion.
Yeah.
So liver cancer, who is at risk for liver cancer?
So liver cancer is generally, healthy people aren't at risk for liver cancer, but people with chronic liver damage, people with liver diseases, chronic liver diseases could get liver cancer. Those can be anywhere from people who have hepatitis B, hepatitis C, chronic viral liver infections, people who drink too much alcohol. But it can also be people who have non-alcoholic steatohepatitis or fatty liver disease, which is kind of a growing problem in the United States and in the world now. So anything that leads to chronic damage, death of cells in the liver, proliferation of the liver.
Okay, so are there
that sort of thing?
Gotcha. So are there different types of liver cancer? Are there different phases? When you talk about breast cancer, there may be like stage A, stage 0, stage 1.
Yeah, so I think this is an important point to think about, because actually the most common kind of liver cancer is the cancers that come from other places and metastasize to the liver.
Right.
So those are called metastatic cancers. That can be from anywhere, the breast, the colon, anywhere.
Right.
And those are cancers that have traveled to the liver and taken up shop there and then harmed the liver. The ones that we're talking about here are more the primary liver cancers, which arise from cells within the liver. So that can be broken down into bile duct-like cancers, or cholangiocarcinomas, or what's called hepatocellular carcinoma, which is thought to arise from the hepatocytes, which are one of the main kinds of cells within the liver. So hepatocellular carcinoma is the most common form of primary liver cancer.
Okay, good to know. So how do you diagnose liver cancer? There are those three types of primary liver cancer.
Yeah, sure.
Are there different ways to diagnose each one, or is it a similar process?
So rarely, sometimes people will come into the doctor's appointment with symptoms of abdominal discomfort or weight loss, or the very general kind of health problems that might be associated with cancer. And then upon imaging or something like that, they'll find it incidentally. More ideally, we're following patients with risk factors for liver cancer, with chronic liver disease, and then we surveil them, or we do surveillance imaging like ultrasounds every 6 months and blood tests to see if a new one comes up. And that's very important, because if we catch them relatively early in their cancer process, that can be cured.
Gotcha. So that gets to a question that we have gotten in from CC. And it's, can I make lifestyle choices to lower my risk of developing liver cancer?
Yeah, certainly. I think an important thing is to, if you have risk factors associated with chronic liver damage, like hepatitis C or hepatitis B, obviously there are amazing curative treatments for those now, and those viruses can be eradicated with medications. So eliminating the viral insults can reduce the risk of liver cancer dramatically.
Gotcha.
Also, overconsumption of alcohol, obviously that makes common sense to reduce that consumption of alcohol. But nowadays, with the increasing risk of fatty liver disease due to obesity, metabolic disorders, diabetes, then obviously lifestyle choices in terms of weight loss, reducing diabetes, that sort of thing will reduce the risk.
Okay, so we have a question in here from Christy, but I want to get back to something you mentioned. You mentioned, reduce kind of alcohol intake, watch your weight.
Yes.
With alcohol intake, is there kind of a certain line that is safe to cross, or where should you be?
It's a little bit. The data is a little bit complicated. I think in generally speaking, I would say that men and women should limit their alcohol intake to moderate or very modest amounts. And that's generally 1 to 2 drinks per day for females, and 2 or 3 drinks a day for males. In terms of is there some benefit to absolutely not drinking at all? Maybe, but the relative benefit is smaller as you go super low.
Gotcha.
It's more concerns about drinking way too much that's the big deal.
Right. Okay, that makes sense. So here's the question from Christy, and thank you for your patience. Can someone with liver cancer be treated with immunotherapy? So getting into the treatment.
Yes. So that's a very exciting area right now in liver cancer. And so if we think about liver cancer more generally, there are the early kinds of cancers that can be cured with surgery or with ablative techniques where you stick a probe into the tumor, burn it, and then it'll cure the liver cancer. Then there are the middle cases, or the intermediate cases, where we can give local regional cures like transarterial chemoembolization, which helps to reduce the cancer there. But if those are not possible, if you can't do surgery, if TACE is not an option, then we go into the advanced liver cancer therapies, which are chemotherapy-like medications or immunotherapy. Okay. So for a long time, we had 1 or 2 medications that we could use to fight liver cancer in this population. But in the last couple of years or so, immunotherapy has become an exciting option. Wow. And there are new immunotherapy medications that are effective against liver cancer. And the phase 3 trials are coming out, which will give us more definitive answers about how much that magnitude of benefit will be.
So for those of our listeners and viewers that may not be familiar with immunotherapy, how does it work?
Yeah, I would simply say that this is an amazing kind of new treatment. Well, it's not new anymore. It's been around probably for a decade now. But it's really harnessing the powers of your own immune system to attack cancer. Your cancer in your body will usually try to say, don't hurt me because I'm you. Okay? And so immunotherapy are medications or antibodies that will turn off those signals that say, I'm you, and then turn these cancers into foreign objects. And then the immune system can go ahead and try to kill them. But it doesn't work in everybody.
Okay. So it's an option that could help some patients.
That's right.
Okay.
So the landscape of how we're treating advanced liver cancer is dramatically changing. Every couple of months there are new options that come in. So it's an exciting and good time to think about different kinds of treatment options for liver cancer.
That's fantastic. It's a great question, Christy. Thanks for taking us in that direction. So to follow up with that, you mentioned a couple other treatment options. If immunotherapy isn't an option, what else is available?
Yeah, so I would say for advanced liver cancer, this is the kind that I treat as a medical oncologist. So for about a decade or so, we've had the option of a kinase inhibitor called sorafenib. Kinases are molecules inside or on the surface of cancer cells that allow for cancer cells to grow. So if you block those kinase signaling pathways, then they'll die. So sorafenib and a bunch of other medications like it, Stivarga, and other medications like this, are effective in liver cancer as well. And so there are a number of new ones coming on that have efficacy. So we're trying to figure out what order to use these medications in relation to immunotherapy.
Okay, so great question. We've got some more going back to immunotherapy now. So here's one from Christy. And is immunotherapy for liver cancer currently only available as a clinical trial? And if so, how could someone with advanced liver cancer become a part of that?
I would say that I do encourage people who come to my clinic and to go to other clinics to enroll in clinical trials. Because I think what we have now for liver cancer are singles or doubles in baseball parlance. We don't have triples or home runs. And so we're really looking for those. And I think clinical trials give patients the best opportunity to kind of maybe reach higher than what we have right now.
Gotcha.
And in the case that the trials don't work, you still have the standard of care options to fall back on. And indeed, immunotherapy is a standard option now in liver cancer in the second line setting. But in the next couple of months, we may have new information that tells us we could use immunotherapy as a first medication for liver cancer.
So getting this relates to Carter's question, what makes someone a good candidate for immunotherapy to treat liver cancer?
Yeah, so this is probably, generally speaking, anyone that's a good candidate for systemic therapy or what I'm talking about, medications that go all over your body to treat cancer, are patients who are generally healthy, are not bedbound or not very, very ill. Patients who have good liver function, who are able to metabolize the medications that we give them, because if their liver, remember, liver cancer occurs in patients with liver disease and cirrhosis. So we're really dealing with two problems here. So we need to find patients who have a relatively healthy liver with a cancer that we can treat without hurting the whole patient.
Okay.
So those are the best candidates for immunotherapy. Patients who have gotten a transplant, a liver transplant, who then have liver cancer after they've gotten transplant, that's a more complicated scenario. So, and that, information on that is coming out in the future.
Good to know. Great question, Carter. So we'll just step back a little bit. One of the things you mentioned earlier was the rise of fatty liver disease.
Yeah.
How does that play a role in liver cancer?
Yeah, so fatty liver disease is super common now, in part because I think there's more awareness about it, but also because as the worldwide population has no food limitations, we're now getting overweight, obese, more diabetes, and so in about a quarter of all Americans have fat in their liver, and that's called steatosis. That's a relatively benign situation.
Okay.
But a quarter of patients will have inflammation associated, and that's called hepatic steatohepatitis, or non-alcoholic steatohepatitis. And that's where it gets dangerous. If you have chronic inflammation, it sort of mimics having hepatitis C or hepatitis B, and that will eventually lead to cirrhosis in some people. So we're cutting the pie smaller, but because the pie started out so big, even small fractions of it will become big at the end.
Wow. So does that mean that more people could someday be at risk for liver cancer?
Yeah. So I think you have the people with fat in their livers, and then the people who will get inflammation in their livers, and then the people with inflammation will then progress to getting cirrhosis, which is the end stage fibrotic, kind of super damaged liver that we think about, the hardening of the liver. And then in a certain fraction of those patients, they'll get liver cancer. And those are the patients that need surveillance with ultrasound and blood tests. And also, and liver cancer is a risk of death in those patients.
Okay. All right. So I want to remind everybody we're about halfway into the chat, so keep those questions coming. We've got one here from Christy, and it's related to what you were just talking about. Can liver cancer be cured, or is treatment generally kind of an extension of life?
Yeah, that's liver cancer can certainly be cured, and as I mentioned a little bit earlier, if we catch the cancer early enough, if it's small enough, and the liver is healthy enough, that part of the liver can be resected or surgically removed to cure the patient of cancer. And the beautiful thing about the liver, and the really cool thing, is something that I study in my lab, is how the liver regenerates.
Right.
So you can cut out 80% of the liver in a healthy patient, and over the next 2 or 3 weeks, it'll come back almost completely.
In 2 or 3 weeks?
Yeah, 2 or 3 weeks.
Wow.
So it's a fascinating process, and so that allows us to do curative resections.
Gotcha.
Many surgical resections are done here at Parkland at UT Southwestern. And also there, if you cannot get surgery because of whatever reason, the interventional radiologist can put a probe into the tumor and microwave it, send out shock waves, heat it to burn the cancer if it's a certain size.
Wow, that's really
So
amazing.
there are curative measures like that.
Okay, a really great question. Here's another one that gets to...
Oh, and also I forgot to mention transplant.
Oh, okay.
Right? Even if you have multiple pieces, multiple tumors in your liver, there are situations where even those patients can be transplanted. But of course, the transplant waiting list is long, and there are issues with transplant. But it's a curative option.
It's good to know. All right, great question. So here's one from Lori. And I was curious about this, based on everything you've been talking about. Are there any other screenings or prevention for liver cancer besides Hep C screening?
So Hep C, hepatitis B vaccination, so I think just general medical care. If you go to the doctor and you get a general routine blood test and you find that there are elevated liver function tests, those are usually in the form of tests that detect death of liver cells. And so those tests will rise, and then if they're persistently up, your doctor needs to figure out why that is. Is it because of fatty liver disease? Is it because of hemochromatosis, which is a genetic disorder associated with iron overload, which is relatively common, or medications that you might be taking, or something else? So a basic general medical exam will reveal certain causes of liver damage that may need to be dealt with if they're persistent.
Gotcha. Okay. Really good question there. Here's yet another one, and these are great questions. Please keep them coming. Here's one from Crystal. Are certain demographics more at risk for liver cancer or liver disease? And she specifically mentioned, age, gender, race.
That's a great question. So, in general, the thing that pops out to me is that men are at much higher risk for liver cancer than women.
Really?
And it's not entirely clear why that is, but it's about 3/4 of my patients are men, and maybe a fifth to a fourth are women.
Wow.
There's some genetic, some underlying either hormonal or genetic, and maybe also environmental risk factors that lead to men having more liver cancer than women.
Huh. What about ages? I know children cannot have liver cancer.
So
obviously.
children can actually have liver cancer, but it's a different kind of liver cancer. So children can get hepatoblastoma, which is a pediatric version of liver cancer, but that's a pretty rare disorder. Although it can be very problematic if it can't be resected or removed or cured. That does happen, and we also study that in our lab. In children with genetic disorders, monogenic disorders, single gene disorders that lead to liver damage, they will also be at higher risk for liver cancer.
Okay.
So kids can get this.
Okay.
Sorry, I forgot the question.
But are there, within the adult population, are there certain kind of age groups that are more at risk?
Yes, certainly. Certainly, I think basically the longer that you've had chronic liver disease, the higher risk you have. But generally, the patients that I see are in their 50s to 70s.
Okay, so a little more in there. Great question. So here's a different question. Now, you see patients over at Parkland, the multidisciplinary clinic. This question really deals with, advice. And what type of advice would you give a patient whose cancer has spread to the liver from another organ and has reached a more advanced stage? Is there help available for them at UT Southwestern through clinical trials or standard care treatments?
So this is a very general situation. So it ultimately will depend on what kind of cancer it is. So the first important thing is to diagnose the kind of cancer it is, and that usually involves a biopsy, various scans to figure out if there's another tumor somewhere, and the treatment will be completely catered to what kind of cancer it is.
Okay.
Because if it's breast cancer, then there are breast cancer treatments. If it's pancreatic cancer, pancreatic cancer treatments. The cells in the type of cancer they are will determine whether or not they're responsive to different treatments.
Okay, so if you've had, just for me to clarify, so if you have like breast cancer and it spreads to your liver, you'll undergo breast cancer treatment instead of liver cancer treatment. Yeah,
and not necessarily localized breast cancer treatment, but medications that are highly effective for breast cancer, like hormone therapies, or prostate cancer that are responsive to hormone therapies.
Okay.
Whereas if it's colon cancer, then it's a whole other set of chemotherapies.
Gotcha.
And UT Southwestern treats all kinds of different cancers and have experts in these different disease types. So the first important step is diagnosis.
Okay, sounds good. Great question. Here's another one, and we have about 8 minutes left, so keep them coming. Here's one from Sarah. What are liver lesions, and how do they develop, and could they turn into cancer?
Liver lesions just means that it's anything that you can see on imaging that looks like abnormal.
Oh, okay.
So it's another word for mass or growth, and they could be anywhere from a malignant disease like metastatic cancer or HCC, or it could be completely benign. So it really will depend on the diagnosis of that lesion. It could be related to birth control medications that young women take that give them risk for hepatic growths called adenomas and things like that. Those need to be diagnosed on a per lesion basis.
Good to know. Okay.
So it doesn't mean it's necessarily bad. Could be fine.
Gotcha. Great question, Sarah. Here's one that we're getting back to treatments. I know we're kind of bouncing around a lot here, but are treatments different for cancer that begins in the liver as opposed to cancer that has spread from another organ to the liver?
Very much so, yes. So again, this sort of links back to figuring out the proper diagnosis, and then once we have that diagnosis, figuring out how that cancer is treated, and even sometimes figuring out the genetics of the cancer. There are more and more new treatments that are based on the genes that are defective in that particular cancer that could be more responsive to one thing over another.
Gotcha.
So all of that will depend on how it's diagnosed.
Gotcha. So I know you're based here in the Children's Medical Center Research Institute at UT Southwestern. What do you see on the horizon in terms of either new treatments, new screening methods, and what's happening on the research end?
Yeah, so one thing that we are really interested there, of course, there's a whole variety of different research topics in this area, and it's a really exciting area because it's a growing problem. More and more people have it. The problem of fatty liver disease is causing this to become a global health. It's always been a global health problem, but more of an American problem now. And one of the things I'm interested in is the sort of evolution of how damage, which leads to regeneration and healing, and then inflammation and scarring, how that evolutionary process on the per cell basis leads to liver cancer. And if we can figure out how and why this occurs, we can maybe figure out how and why we can reverse it.
Wow.
So one of the areas we're looking at is how modulating or affecting how the liver regenerates or heals could make liver disease less bad, and then maybe reduce the risk of liver cancer in the future.
That would be pretty amazing.
Yeah, so there's a lot of active research in this area, and at UT Southwestern, there's a lot of interest in fatty liver disease and the genetics of fatty liver disease that put certain people at greater risk than others.
Definitely. All right, that sounds amazing. So here's one other question we've got here, and since you brought up earlier, we were talking about risks. You brought up, women taking birth control. The risks of developing breast cancer. The risks of developing breast cancer are known, but does birth control also increase the risk of liver cancer or other cancers? Are you aware?
Yeah, I'm not going to tread into that territory because I'm not as well versed in that. It does not have a clear link to the kind of malignant liver cancers that we're worried about.
Okay. That is.
But obviously, that's a complicated area that deserves more focused treatment.
Yep. Great question. We're gonna kind of have to let somebody else talk to that one. But thanks for asking. So, what do you when patients come to you and they're dealing with liver cancer and they're not sure what direction they want to go with treatment, what do you tell them?
Yeah, so I think obviously we have to take this on a case-by-case basis. So any time that there's an opportunity for a cure, we're always aiming to do that. So whether or not it's surgical resection, whether it's liver transplant. So anytime that someone is eligible for a transplant or resection, that's what we think about predominantly, because that's the most important thing. And then if they get to if they're needing intermediate or advanced stage treatment, then we really encourage people to go on clinical trials. And so you really want to go to a place like here, like other places, that have very good clinical trial options that really give you the chance to improve upon the existing treatment paradigms. And so I think that's a key thing.
Okay.
And I think obviously it's not a good thing to have liver cancer in any form, but today there are more treatment options than ever, and there's a lot of excitement in the area. So I think I wouldn't lose hope. There's a lot of possibilities and a lot of types of things we can throw at this cancer that could make things better.
Awesome. You know what? I think that is a perfect place to end on
Thank
a note
you.
of hope. That sounds great. So I think we're going to go, we are just now getting close to the end of time. So if you have that last minute question, we're happy to take it. But otherwise, we're going to start to wrap up. I do want to make sure that we thank, obviously, CRI for hosting this with us, as well as Parkland and Moncrief. They're great partners. And then the last one would be our team at the Simmons Cancer Center. If you have any other questions, just remember, you can leave them here and we'll address them after the chat. This chat will be available here on Facebook, and it'll also be posted to our YouTube channel later this afternoon. So we'll be sure to share the link in the event page. In the meantime, I want to thank you for spending all this time with us.
Thank you so much. This is really fun.
It was great. Lots of good questions. So thanks for joining us today.